Hey guys, welcome to this month's edition of Medicare GPS podcast, navigating you step by step through your Medicare journey. My name is Paula White.
And I'm Jamon White. We're co-founders of Four Oaks Medicare Planning. And we're going to revisit a really interesting topic. Medicare Plan G supplements. Premiums are skyrocketing. So we wanted to dive a little bit deeper. These are some of the most popular plans. A lot of people are on them, but are on fixed budgets and might not be able to handle these premiums. So we're going to look into that.
Yeah. So don't forget to like and subscribe, and we'll get into today, maybe switching from the G to the N. All right, so let's get started. So first, Jamon, why don't you describe what is a Medigap plan and how people know if they have that plan or not?
Sure. So remember, when you're on Medicare, you generally are either on a Medigap plan or a Medicare supplement or a Medicare Advantage plan. The way to know which one you're on is, do you have original Medicare A and B, and then have another card like a Plan G or a Plan N that supplements original Medicare, right? You're not under the Medicare Advantage system, kind of the managed care, where you have one card that picks up your doctors, hospitals, things like that.
Yeah. And why are the premiums going up so much? Like, why are we seeing those premium increases?
Well, what we're really seeing is medical inflation is happening. A price of eggs a couple of years ago started to skyrocket. There's a little bit of lag when it comes to the Department of Insurance and the filings. So that medical utilization is also up. And then technologies, our ability to go in and, the treatments of cancer, all those things are very, very expensive.
Yeah.
So all of that is hitting right now. And we're just seeing, that what the premiums were based on in the past are not what the insurance companies are liking. So they're going to the insurance departments to get those increases, and they're being approved. We're seeing 15, 20% and higher increases for many Medicare supplement Plan Gs now.
Yeah. So one main option they have, as we mentioned in our podcast last month, and so if you want additional information on this, definitely check that one out as well, was an option of going from the G to a different plan, say the second most popular plan, which is the Plan N. Kind of go into why someone would want to do that and what are those main differences.
Right, so the Plan G, or even if you might have a Plan F, those are like the Cadillac plans, right? They're going to cover most everything under Part A and Part B that you'd be responsible for. So it feels really good, but again, it's balancing that cost and coverage. You can have that Cadillac coverage, but the costs are moving up as well for that. So really, that's what the G does. It basically pays all your co-insurance and deductibles under A and B, except for that one small Part B deductible. So we call it potentially downgrading coverage. So really, downgrading doesn't sound great, but there's still great options that give you that Medicare supplement coverage, that freedom to go to a doctor that accepts Medicare all throughout the United States. It keeps you in that system, but just gives you a little bit of extra responsibility. But for that, you're rewarded. The insurance company, if you're willing to pay, they're going to give you a premium reduction, right? And so that's what we're talking about, is that strategy.
Right. So let's go into a little bit more of that. So the N, what are those specific things that are different on the N than the G that, allows a little bit of price break?
Right. And I like the Plan N.
I love the Plan N.
I think it's a great option. Yeah. So we already talked about the Part B deductible. So when you're on the G plan or the N plan, you're still responsible for that. So that's the same. But there's basically two additional things that you're responsible for under the N. Otherwise, it's the same coverage as G. Right. So remember that. So what are those two differences? One are co-pays. If you go in for an office visit under the N plan, you could be subject to a $20 copay. And then if you go to the ER, you can be subject to a $50. Now, there's no copays under G, but I think those copays are pretty reasonable,
Very reasonable,
right?
Very reasonable.
And then the second difference is something called the Part B excess charge. Now, if you chose to go to a doctor under Part B that wanted to be in the Medicare system but charge you more, they're allowed to do that. Medicare will let them do it, but they cap the amount of extra they can charge you, and that cap is 15% above the Medicare approved rate. right? That's what's known as the Part B excess charge. Now, under a Plan N, if you were exposed to that, you'd be responsible for that extra 15%. Under the G plan, you're not.
Okay.
So for those two differences, the N plan can be a great option because the premium is less. Sometimes it's 30, 40, 50, kind of depends on what you're on, but it can be a pretty substantial decrease in your monthly premium.
Yeah.
And some people are like, Part B excess charge 15%, that's scary. But what I'll tell you is, historically, it's rarely a doctor is going to charge that.
I think they make it really hard on the doctors to be able
Yeah,
to do.
yeah. I don't know why, but I mean, it could be a factor in the future. But sometimes all you have to do is ask the question. If you ask them, do you accept Medicare payment in full? If they say yes, you know you're not going to be exposed to an excess charge. And if that's out of the way, you just have those little additional copays, and suddenly you're reaping the reward of a pretty lower premium.
Yeah, for sure. Well, definitely this has been a super hot topic. We've had a lot of inquiries about it, and so we actually have a blog on our website that you'll want to check out. It's called Switching Medigap Plans from Plan G to Plan N. Very, very popular. A lot of people have been checking that out, so make sure you take a look at that.
And let me just add something that's really important too. You know, depending upon what state you're in, you need to be aware that if you want to change from a G to an N, you'll likely have to answer medical questions, right? So it is important, reach out to us and we'll go over kind of what your medical status is. See if we can't give you a thumbs up to put in an application and see if we can't lower that premium.
Well, that's a good point. One thing we can do in that initial assessment is see if it even is a good option for you. Because sometimes it's not a good option. If you're going to the doctor 3-4 times a month, then it's probably not going to be a good option to switch to the N, because you'll just get eaten up any of those savings through your copays, right? So a lot of it is just dependent on your situation, and we're happy to walk anybody through that.
Everything's a one-on-one discussion, right? And a lot of these companies, the health questions are different.
Yeah.
So, you know, having an independent agent to help you work through the 10 or 15 companies that one might say yes, one might say no. So we just dive into that.
That's awesome. Okay, now let's move on to story time. So we had some interesting things come out of Washington, D.C. this month. Some headlines talking about Part D, and some people misunderstood what was actually going on. So kind of explain what's happening and what is actually going on.
Yeah, so the Part D program under Medicare is for your prescription medications, right? And one of the biggest questions that we've had this week is, I've heard that the Part D program is ending.
Where's it going?
And I'm like, no, it's not ending. So let's just set the record straight. Part D is mandated under federal law. So do not worry, Part D prescription program is going to be there. But when the Inflation Reduction Act brought in some new things on Part D, like the out-of-pocket max, that was a law that was passed in 2022. That affected rates on Part D plans, right? And so the government was concerned about that. So they put in a subsidy program, essentially paying the Part D drug companies, insurance companies, a little bit more money to kind of ease them into this new system, or, you know, how things are structured. So that is called a subsidy demonstration program. So what actually is happening is that subsidy demonstration program has been phasing out and just being lower each year. And now for 2027, it's being phased out completely. So it just means take a look at your ANOC. You know, if you're on a Part D plan, just be aware of the prescription drug program that you're on and see what's changing for 2027, because we could see a little bit of an impact. But the Part D program is not ending. It is here to stay.
Yeah, I think the biggest thing to note about this is that there likely is going to be some pretty, you know, potentially significant increases in Part D premiums.
Yeah, potentially. I mean, remember, the subsidies have been lowering over the last couple of years. So I think the understanding between the government and these insurance companies is, hey, you have a better way now to price your plans. So we'll just have to see. The jury's out on what it's going to do.
Right.
Some insurance companies participated, some didn't. So, you know, those that participated, we might see a little bit of a jump in premium. How much?
We don't know. Yeah.
We'll see in October.
Yeah. Well, we did also put together a blog on this topic because it's also very hot in what's going on in our world. So definitely check that out on our website on what is happening with Part D drug plans.
Speaking of hot, it's hot here.
Yes, it is.
We just got back from vacation where it wasn't.
We loved it. We went to Alaska on a cruise and got to see all kinds of things, catch big fish. What was your favorite part?
Trout fishing.
Yeah.
Just being on the water and going to a river and kind of trout fishing for a few hours, caught some trout, and just beholding God's glory.
Yeah.
Really. It's beautiful.
It was a magical place. I definitely had a hard time readjusting to the Texas heat after that.
Yeah, 60s, you get pretty used to it. What was your favorite?
I would say when we caught the fish and then went and cooked it right away. I thought that was really, really cool. That's one of my favorite things in the world is to catch a fish and eat it.
So Alaska cruising bucket list.
Absolutely. If you haven't done that,
you should go.
Absolutely try to get on that Alaska cruise, especially if you need to get out of the heat.
Yeah, absolutely.
Awesome. All right, so news. What is going on with news? We know we have birthday month is August 1961. Is when we need to be signing up for Medicare. Also keep an eye out on the summer heat. Just like we're talking about, a lot of heat going on. Make sure you're staying in the shade, getting a lot of water, doing all the things, take care of your pets. Just keep in mind those heat things because a lot of seniors do struggle with heat during this doldrum of a month of August.
And if you're one of our clients that's up north, pray for us. It's really hot. And we'll be sending prayers to you when y'all have, 12 feet of snow on the ground or whatever. Right. So, no, we're blessed, but it is hot. So.
Yeah. All right. Well, that kind of wraps up today. So make sure, again, you like and subscribe and share this with any friends that maybe are on a Plan G and struggling with what are they going to do? The premiums are getting too high and they're on a fixed budget. We'd love to help them and talk to them about that. Definitely next time, we have a great topic. We're coming up close to that annual election period. So we'll be talking about the annual notices of change that you'll be getting in the mail.
In September.
In September.
So be lookout for that in September. They're really important.
Yeah. So keep an eye out for that, and we'll see you then.
Sounds good. Bye-bye.